Hi, my name's Aimee. I'm the page manager at Breastfeeding Mama Talk, and today I'm here to talk about how to properly latch your baby onto your breast. So when we get started, or as we get started, I first want to mention that you should always make sure that you are as comfortable as possible. So when I was breastfeeding my baby when he was a newborn, I like to have a pillow behind my back, pillows behind my arms, and then I could reposition them as I got him latched on. I always made sure to have a nice glass of water beside me, a healthy snack, my phone, a book, anything that made me most comfortable because, I mean, when you're breastfeeding a newborn, it sometimes feels like you're breastfeeding 24 hours a day. So today, this is what I'm going to demonstrate how to latch a baby on. My baby boy is 19 months old now and definitely does not take this much work to latch or breastfeed. So the first thing I want to mention is that whenever you're latching a baby on, always bring baby to breast. Never bring breast to baby, as that causes extreme back strain and back pain. And when that happens, you might have to get more comfortable, unlatch baby. It just extends the process, but also it does hurt your back. So it's going to make things more uncomfortable just in general. Now that we've finished discussing that, today I'm going to talk about the cross-cradle hold. So with baby, just let me adjust the camera, you want to go skin to skin is nicest because then baby can smell your scent, they can feel your warmth, they're reminded of what it was like to be in your stomach. And then you think belly to belly and chest to chest when they're on you. You get baby's legs curled up into the opposite arm from the side that you're breastfeeding on, and then you move your arm up baby's spine so that you have control of baby's head. Okay? Now, like I said, you bring baby to breast at all times, and when you've done this, you take a look. You look at the ear to the shoulder to the hip and make sure it's nicely aligned in a nice straight line. This is most conducive to the suck and swallow motion that the babies have to do, and it really is the best way to make sure, one of the best ways to make sure that that latch is correct and that the baby's on properly and it's not going to cause you any pain. Now, when you grab your breast, you're going to grab with the same hand that's on the side that you're breastfeeding on, and you grab it's an upside down C or a C, whatever's most comfortable. I find it most comfortable to go upside down. Now this compresses, when you hold your breast like this, it compresses the breast tissue so that you're able to get more of it into the baby's mouth. Now what I want you to do is I want you to take the nipple and brush it from nose to mouth over and over again until your baby opens its mouth wide open, and at that point you're going to take your nipple and get as much of the nipple and the areola in as possible. You do not want the baby to be only on your nipple, so you need to get that areola in as well, which is why it's so important to get your baby to open wide as possible. So now that you have baby latched onto your breast, you take a look at the latch. Do you see the lips flanged out? Do you see the tongue over top of the baby's bottom gums and over top of the baby's bottom lip? Okay. When the baby is sucking, do you see indrawing of the cheeks? Because if you see that, that is incorrect. And then we'll talk about what you need to hear in a moment. But first, I want to say, let's say you did see something. The lips weren't flanged out properly. You saw the indrawing of the cheeks. And you figure maybe I latched my baby on incorrectly. So at that point, there is a proper way to unlatch a baby. Rather than just ripping baby off your breast, which is going to cause trauma to the breast tissue and make it painful to breastfeed in weeks to come, you want to take your pinky finger and hook it into the side of the mouth of the baby and just gently pop baby off. So you would do that, just take your pinky, unhook baby, and gently pop baby off. And that is going to prevent any breast tissue trauma from happening. Alright, so let's latch baby back on again. So remember, you rub your nipple from nose to chin, compressing that breast tissue, getting it as much in the mouth as possible, and then looking for that correct latch. And now we're going to talk about what you'll hear. So at first you're going to hear this really fast suckling, and that is baby stimulating your letdown to come down. Actually, if you listen to the Medela pumps, they do a really great job of emulating the two types of sucks that the baby does. So you'll hear that really fast one, which gets the milk letdown to happen, and then you'll hear the second one, which is a long, drawn-out suck. And you'll usually hear the baby go suck, suck, and then swallow, and suck, suck, and swallow. And that is totally and completely normal and what you should be hearing. Now, early on, breastfeeding is exhausting for the baby, so it's very normal for the baby to fall asleep at the breast. And you should try and stimulate them and make sure that they're completely done before you let them go to sleep. That's the nice thing about having skin to skin, is if baby's naked, you can just, tickle the feet, blow onto the face a little bit, wake baby up a little bit more, see if baby wants any more. If baby truly isn't hungry, he's not going to work on getting the milk out. That's the thing with breastfeeding, is it definitely takes work. So you can try and stimulate the baby as much as possible, and if baby's truly tired, it's okay to let the baby go to sleep. That's all right. But do try and make sure that the baby is not only getting what they need, but also stimulating your breast to get your supply up to meet what the baby needs. Next, I just want to discuss what you want to be looking for to make sure your baby is getting enough milk. So for each day of age up until about a week old, you're going to see one poopy diaper and one wet diaper for that day of age. And then at about a week, you'll start seeing just the same amount, about 4 to 5 dirty diapers and about 6 wet diapers is good, up until 6 weeks. And up at that point, your baby might start going up to a week or 10 days without pooping, and that is okay. That is totally normal. However, that baby still needs to have 6 wet diapers a day, and that indicates that the baby is staying well hydrated and getting everything that he needs from your milk. The other thing you should watch for is to make sure baby is steadily gaining weight, because that is also an indication that your baby is getting everything it needs to from the milk. And I know that sometimes you feel that baby has been latched on forever, is constantly eating, and there's no way you could possibly be making what baby needs. But when they're doing that, with chances are it's growth spurt, they really are stimulating your supply to make sure that it gets up to what they need. There's no reason to introduce formula at that point. Just keep the baby to breast. That is the most important thing. I highly suggest you check out our website, www.breastfeedingmamatalk.com, for lots of information on things like growth spurts or how to keep your supply up, nipple shields, all sorts of interesting stuff, because that'll give you an extra little glimpse into what's going on with your baby. And as well, I hope you stay tuned for more movies from us on how to, as this is our first one. So thank you very much. Bye.